Awesome. Well, good afternoon again, everyone, and thank you for joining us. I'm Aisha Akhtar. I'm the Vice President of Health Equity, Education, and Advocacy at the Epilepsy Foundation of Greater Chicago. Thanks for taking time out of your day to join us. And if you're off camera having lunch, no worries at all. Thank you again for being a part of our journey on exploring seizure rescue medications. At EFGC, our commitment is to ensure that everyone living with epilepsy and also caregivers, regardless of their background, geography, or income, has access to accurate information, quality care, and the tools that are needed to manage epilepsy safely. So education is a very important part of advancing health equity. As you know, seizure rescue medications can play a very critical role in a person's seizure action plan, which is also another very vital component of all of this. And when used appropriately, they can definitely interrupt the prolonged or cluster seizure and potentially prevent emergency situations, which is something we all would love to do. But of course, we know that access, affordability, the know-how, and the awareness all matter. And so a medication is only going to work if people know about it and how to obtain it and how to use it. So today, we're so lucky that we've been able to invite two representatives from different pharma companies to share information about their respective FDA-approved rescue medication. And I just wanted to say that while EFGC does not endorse any specific one or the other, we believe in creating a very transparent space where patients and caregivers can hear directly from the manufacturers and ask any questions that you might have. So we're looking forward to having a very robust conversation. Throw your questions in the chat and Lacey will moderate this webinar. So for now, I just want to thank you for being here and for being an advocate for your health and for the community. So with that, I'll turn it over to Lacey, who will introduce our speakers. Thank you.
Hey, thank you, Aisha. Hi, everyone. My name is Lacey. I'm the Health Equity Coordinator at the Epilepsy Foundation of Greater Chicago. Welcome to webinar number 2 in our spring series for Epilepsy and You webinars. Today, as Aisha mentioned, we're going to talk about rescue medications, and we're hearing from two really great speakers who are experts in seizure rescue medication. So I wanted to quickly introduce them to you all. So speaking first is Dr. Kelly Murray. She is a pharmacist and has experience working in inpatient neurology, outpatient pharmacy, and the neuro ICU. In her role at Neurelis, she works with insurance companies to work to ensure that they understand both the clinical and business aspects of the seizure rescue medication and assure the best possible coverage for people with epilepsy. And then speaking for UCB is Dr. Raj Sandhar. He is the Senior Medical Science Liaison. He leads medical affairs activities across the Pacific, and is also a pharmacist with over 6 years of clinical neurology hospital practice experience. He works with UCB across their epilepsy portfolio in both the US and Europe. Thank you both so much for being here with us today. And before I hand things off to Dr. Murray to get us started, just quickly mentioning that we will have a post-webinar survey. I invite you all to take it. If you've been here before, you know we love a good survey. So this is just an opportunity to share any feedback you may have, any suggestions for future webinars. So please do take the survey if you have a moment. I'll also send a link to this afterwards. Okay. And then with that being said, I will hand things off to Dr. Murray to get us started.
Thank you. And I am going to, let's see, does allow multiple presenters to share. I guess I will allow that. And I will share. And I think when the next speaker goes, he'll be ready to share doing that. So wonderful. Well, welcome everybody. This is also kind of a new experience, I think, for me with regard to kind of having a split time here with my counterpart over at UCB. So I think that my presentation will focus on obviously Valtoco. That is the product that Neurelis manufactures, but I'm also going to talk a little bit about the types of seizures and some of the other things that go along with this. And we've not shared our presentation, so you might see a little bit of overlap, which I think is great because we can both approach that education. But with regard to the product, the one I'm talking about is Valtoco, which is diazepam nasal spray. And, we always kind of start with the indication and the use. But here, I also want you to know, like, as I go through, you'll see a lot of the safety information sprinkled throughout. And Valtoco and Nayzilam are both benzodiazepines. So you're going to see some common things that are part of the benzodiazepines as far as taking them with opioids, cautions on driving and making you drowsy and all of that. So that's very typical with these products. It may affect different people differently, but those are kind of sprinkled throughout. And then I have some safety information at the end. I know we have a Q&A, but I do want to just, this is not intended to replace medical advice or advice you get from your, providers, from the Epilepsy Foundation or anybody else. So definitely any specific questions related to care, we won't be able to, or I won't be able to address, but you can always take this information back to your provider. So the goals of this presentation are, first, obviously understand the impact that seizures can have on your life, learn how daily and immediate use medications kind of work together. I'll kind of distinguish those two. We'll talk about Valtoco specifically, what it is, how it works, all of that. And then I will have a small section on tools and savings. And get your phones ready because I do have a few QR codes that you can take right on the screen. Hopefully that'll work. Or you can go to our website, or I also know the Epilepsy Foundation has a lot of some of the same resources, as you'll see. So the first thing is, and I really don't have to tell any of you this, you know that seizures are unpredictable. And so that creates worry, that creates just an ongoing sense of, wanting to have something reliable to have with you in the event that you have a seizure. So these stats are from a survey, and they are probably not surprising to anybody here. People live in fear of having a seizure because you don't know when it's going to happen. Losing your ability to drive, worrying about losing your independence, worry about having a seizure in public, and of course, worrying about brain damage or effects that may last beyond the initial seizure. And so, just to kind of dig into this a little bit more, things that kind of happen immediately, brain fog, confusion, you might have just this kind of anxious feeling. There could be injuries, obviously, or physical injuries, things like that. And then things over time that I'm sure you've discussed with your provider are learning problems, memory issues, just really looking at the frequency of your seizures and making sure that you're controlling those so you don't just keep having more and more. They always say seizures beget seizures, and so I think we can all agree that the fewer seizures anybody has, the better. So that's what both of these products will help in your toolbox of things you have to treat your epilepsy and your seizures. And again, this is just really things but just really it can affect not just your physical being, but everything in your life. And these are just some of the examples. So when you look at managing episodes of frequent seizures, I think the biggest thing is, what do we call these? Because you may have a different word that you use. Your provider may have a different word they use. We have definitions that were used for the clinical studies that went to when we studied these products. Essentially on the left, you see 2 or more seizures, typically in a 24-hour period. That's a very common definition. It's not the only definition, but they're usually kind of different. And I've talked to providers, and just in my clinical practice, you always kind of hear, like, I know it's going to be the one that's going to either not go away, it's going to come back, it's going to be back to back. So you all probably know better for both yourselves and your family member, which one's going to be that one that you really need to treat. On the right-hand side, you see some of the different names, seizure clusters, acute repetitive seizures, breakthrough seizures. Again, back to back, I think, is one that you hear a lot. It's not listed here, but multiple seizures. So the bottom line is they can be called different things, but each person individually knows what they or their family member experience and which ones that you need to treat. And you may learn this over time too. And so really, when you think about that, it's really important to think about these episodes in the context of the type of epilepsy you have. So you may have focal epilepsy or generalized epilepsy. You could have any type of seizures or epilepsy. These seizures can occur with any of them. That's kind of the bottom line there. And then just to distinguish, so we've referred to these as rescue medications, acute medications, immediate use medications. And it's important. So on the left-hand side, you see, daily medications are kind of a mainstay. That doesn't 100% mean your provider has put you on one. Not everybody, but a vast majority of people are on a daily medication, if not two or three, just to control your daily. You take the pill every day, and it's really meant to reduce you from having, as many seizures as you can. And oftentimes, even when you do that, you still have seizures. And so when you go to the right-hand side, that's where the immediate use or the rescue medications come in. And when you ask doctors or providers, most of them say, yes, we should have an immediate use seizure medication. Um, but I think the purpose of this education is that you all are familiar with this, because as much as your providers think you should have one, they don't always think of it. You've got a lot of things you're going in with, especially if you're newly diagnosed. And oftentimes it's an afterthought, unfortunately. Or sometimes they may use other medications that maybe aren't as appropriate. For example, an oral medication, really not the best thing to take. I typically talk about this, and it's not really in this presentation, but you all being part of the Epilepsy Foundation and having all of those resources are very familiar with seizure first aid. And so oral medications are really not recommended. And so when you start to look at both of these intranasal medications, you'll see that there's a reason why they're intranasal. And so, these are when your seizure happens, as we'll go into more detail. So this is a slide. If you have a smartphone or a camera phone, you can take a picture. These are just resources. It's really, really important that everybody, and I don't know the full makeup of the audience, but I know there are families who have smaller children. Schools pretty much mandate seizure action plans, which is great, but even adults should have some type of seizure action plan. And so you can go to each of these, and I know with your connection to your local epilepsy foundation there in Chicago, or wherever you are, if you're not from Chicago, there are a lot of resources, but there are some other ones listed here as well. And you can get them in different languages. So it's really important to have these and to really make sure you're sharing them broadly with friends, family, everybody else who is around you on a regular basis. So now I'll talk about Valtoco. So the first thing about it, we kind of already talked about this, but it's used for short term. So it's used when you have those episodes that you are likely not going, they're not the ones that last just a few seconds. They're the ones that are going to happen for a longer period, and or they just keep coming back, like they're back to back. Valtoco is indicated in both adults and children 2 years of age and older. And as I mentioned, you'll see some of these safety things sprinkled throughout. As far as what Valtoco looks like, actually both Valtoco and Nayzilam come in the same device. And you'll know if you're familiar with Narcan or other things. So you can see this is the sprayer, and you can kind of see it here set up next to different common items. So it's a relatively easy to carry type of product. And that's the whole point, is you want to carry it with you wherever you go, because it can be used wherever you go in the event that you need it. I always say that any acute seizure medication is something you want to have and not need versus need and not have. So it's really important to have it. As far as the adverse events, You'll see things like nasal discomfort, change in taste, nosebleed, and runny nose. These are what we call local side effects. So they kind of happen right in your nose. Um, some people, around 2%, kind of feel sleepy and drowsy. And then, of course, these are not all of the side effects. So you'll want to definitely, you can go to our website, you can talk to your provider about all of the other, there are other side effects to any medication. With Valtoco, the device is nice because while we want all of you to observe seizure first aid, right? You want to make sure the person is lying down as much as is possible. The thing about Valtoco is you can use it in any position. So if you had somebody who is in a wheelchair, for example, and you can't get them out of the wheelchair, it works when they're sitting up. It's just, again, making sure that you're observing seizure first aid. So it can be used anywhere. We're going to talk about the dosing in a minute. It doesn't get absorbed really fast, which is great. And when it's given in the first 5 minutes of a seizure, your provider may have different directions for you. It can stop the seizures within 2 minutes. And so most people use, and most is about 87% of the episodes that were treated, utilize just one dose of Valtoco. So it works quick, and it's typically just after the one dose. Now, the unique thing about Valtoco is that it comes in 4 different dosage strengths, and so your doctor is going to determine your dose based on your age and weight. And so it comes in 5, 10, 15, and 20. And if you think about this, it makes sense. Our indication is from 2 years old up to however old. And so essentially, an adult that weighs 200 pounds may need a different dose than a child that weighs 100 or 50 pounds. So it's really customized based on their age and their weight. And you can see here below that if you do need a second dose, which, as I mentioned, 87% of the episodes did not, you can use another dose after 4 hours. And essentially, per our package insert, you would use up to 10 doses a month. Some people have one seizure every few months. Some people have several seizures a day. And I'm sure all of you are very familiar with your own or your family members' seizure pattern. So as far as how to use it, essentially you would basically just hold it. You'd put it into the nostril until the fingers are against the bottom of the nose, and you literally just push the button. And so essentially, when you do that, you don't ever prime it, because once you push that button, it gives the dose. It's already all set to go. And then with the 15 and 20, there are two sprayers in the blister pack. And so essentially, when you open that blister pack, you use one, and then right after you use the other one in the other nostril. So you use both of the sprayers. That's one dose. And so it's pretty straightforward. We do have resources on videos and various things to help you if you wanted, instructions on it. And another unique thing about Valtoco is that it is now packaged as a 5-dose box. And the reason we did this is that what we found is providers, and as was mentioned, I'm a pharmacist, so pharmacists think in doses and providers think in boxes. And we really tried to educate providers. They would write 2, meaning they wanted you to have 2 boxes, which, just makes sense to them. Then the pharmacy would fill it and they would get 1 box, which was 2 doses. And so we changed the configuration so that people are ready to essentially have it at home, have it at school, have it at work, have it in your gym bag. And so it really helped to be prepared for, for giving you what you needed instead of feeling like you had to hoard it or save it. The other thing is as was mentioned, I do work with our insurance companies, and most insurance companies will pay for up to 10 doses a month. So you're getting 5 doses for each of your copays, or for your, however your percentage copay, whatever you do with your insurance. And so essentially, this is the wrap up. I only have a couple more slides. Can be administered anywhere by anyone. It's ready to use. The shelf life actually is very long. And what that means is when it's dated by the manufacturer, The 5 and 15 have a 32-month shelf life, and the 10 and 20 have 36 months. So when you get that package from the pharmacy, you're going to see it's got a pretty long shelf life. Easy to carry. We talked about the dosing, and you do not need to refrigerate it. You shouldn't leave it in your hot car, or in the case of how it is right now in Chicago, your cold car, but just keeping it at a normal room temperature is good. And then Neurelis does have, it's available at all retail pharmacies. There is a copay card, and you will pay as little as $20 with the copay card. So that's super important. If you have commercial insurance, make sure that you're using a copay card. You can go to our website for that. We also have, what's really nice is we have personalized support. So we have people who can work with you, work with your providers to make sure you have access to Valtoco, but also there's links to epilepsy community resources as well on our website, and also at My Neurelis. You can kind of link to it from our website as well. And these are some of the other things that are on the website. There's another QR code, so I guess, kind of keeping this interactive. You can get kind of a discussion guide to talk to your doctor. And then really, this is kind of the wrap up, just keeps you ready to go should you need it. And I do need to go through some of this important safety information, which you'll probably hear this twice as well, because both products have this. It's a benzodiazepine. You want to make sure you see how it affects you. There is a risk of abuse, misuse, and addiction. So you want to make sure you're talking to your doctor, using it exactly as directed by your provider. You want to make sure that you don't suddenly stop it. You want to talk to your doctor about that. And then it can make you feel sleepy or dizzy. So if you're driving, operating machinery, that kind of thing, you want to make sure you see how it affects you. For any anti-epileptic or anti-seizure medication, you want to talk to your doctor about suicidal thoughts and actions. So your daily medications, any medication, and those things are listed there. And Valtoco and any of the seizure medications really have this warning on them. So you want to make sure you're talking to your provider about that. We've already talked about what Valtoco is. It is a controlled substance. And so you want to just make sure you're using it appropriately. And we don't have any data under 2 years of age. If you're allergic, you shouldn't use it. Or if you have glaucoma, you shouldn't use it. And then these are a lot of things. I know there's a lot here, but just talking to your provider about other conditions you have, whether it's asthma or any issues in your body, as well as if you're pregnant or planning to become pregnant. And so you want to make sure you're talking to your provider about all of these different things. And we've talked about how to use the medication. So I won't go into that in too much detail, but every prescription comes with a medication guide, which is great. And then finally, after you do Valtoco, you really want to make sure you're watching the person closely, making a note at what time it was given. If you do need to call for emergency help, oftentimes we're hearing from providers, people can kind of get on with their daily activities, which is great. But if you do need to call emergency help, you'll know when you gave it, all of those details. And just watching breathing and things like that, which are the typical seizure first aid. And you should avoid, basically just making sure you're not taking it if you have a contraindication. You should store it at room temperature. And just generally, here are the ingredients of Valtoco. So I mentioned it's diazepam. And I know I went sort of quickly because I want to be respectful of time and our other speaker, but that is all I have. And we have our website and lots of resources for all of you. So thank you so much. I appreciate your time, and I will let our next speaker go. I'm going to stop and let you share.
Thanks, Kelly.
Really quickly, Dr. Murray, and for both of you actually, would it be possible to share any links or QR codes that you had just for resources with me? I can send it out to the attendees later, if that's okay.
Yeah, yeah.
Okay, perfect. Thank you so much.
Yeah, hopefully everyone can see my screen now.
Yes.
Yeah, so thanks, Kelly. Yeah, like Kimberly mentioned as well, there might be some repetition. Obviously, we didn't share our slides beforehand, uh, but thank you very much for inviting me today to speak on behalf of UCB and Nayzilam, which is midazolam nasal spray. You may not have heard of UCB previously, but we are kind of known within the epilepsy field as the epilepsy company. So if you haven't heard of our company, we were the inventors of Keppra. We have a long history in epilepsy. So Keppra, Briviact, Vimpat, and Nayzilam now as well are all part of the UCB drug portfolio. So we have a long history in this field, and we are very passionate about patient education. Hence why we love to participate in these type of advocacy events, and we're always available for patients and caregivers to answer your questions. So today we're going to be going through a little bit more detail about Nayzilam. So I'll start off by just giving you a brief overview of seizure clusters and why it's urgent to treat them. We're also going to talk a little bit about the importance of rescue medication, or rescue medications broadly. I'll go into specifics about Nayzilam and how it may help treat seizure clusters, including dosage, usage, and important safety information. So just to start off here, you can see that the indication of Nayzilam, which you see on the top left. So Nayzilam, kind of like Valtoco as well, is a benzodiazepine. It's a Schedule 4 control substance. The indication is for short-term treatment of seizure clusters or acute repetitive seizures in patients 12 years of age and older. Again, because it's a benzodiazepine, there is a lot of important safety information here that we do try and highlight at the beginning and throughout. But we have a boxed warning, as all of the benzodiazepines, in terms of use with opioid medicines, alcohol, other potentially CNS depressant drugs. It's important to be aware as patients or caregivers that these drugs can cause severe drowsiness, breathing problems, potentially even coma and death when used in combination. There is the risk of abuse and misuse and addiction with all benzodiazepines as a class of drugs, so that includes Nayzilam. So it's important to be aware of that, and potential for physical dependence and withdrawal reactions, particularly if it's used like a daily type of medication. And that's why we reiterate and re-emphasize that Nayzilam is an as-needed medication. It's not meant to be or designed to be used daily, and it doesn't replace your regular epilepsy medication. So just a top-line disclaimer. So I am a pharmacist by training. Obviously, for the purpose of this, I'm an employee of UCB who's sponsoring this presentation. Like I said, Nayzilam is a controlled substance. Used in any other way than that specified by the FDA approved US prescribing information is what we deem as off-label, and we do not recommend that as a company, as UCB. So I'll start off by giving you a little bit of an overview about seizure clusters and why it's urgent or important to treat them. We know around 3.4 million people in the US suffer from epilepsy, and up to around 200,000 of those people with uncontrolled seizures also experience something called seizure clusters. Now, it might be something you're familiar with, or perhaps your HCP has spoken about this, but there is, as Kelly also mentioned, we define seizure clusters as having 2 or more seizures within a 24-hour period, often with some recovery time between those seizures. You may have heard of seizure clusters from your healthcare provider described in other ways. So things like acute repetitive seizures or multiple seizures or crescendo seizures. These are essentially all interchangeable terms for the same thing, essentially seizure clusters. But for the purpose of this presentation, we'll refer to them as seizure clusters. It's important to emphasize these are different from your patient's usual seizure pattern. They can also differ from person to person in terms of the number of seizures in a cluster, the type or severity, or even the duration of those patients experiencing seizure clusters. And there's some examples here at the bottom in terms of how people with diverse epilepsies experience seizure clusters in many different ways. So as an example here on the bottom left, you might see repeated absence seizures or like a blanking out type of seizure in a person with a particular epileptic syndrome called Dravet syndrome. Other people may have 3 seizures within 2 days around the time of their monthly menstrual periods or catamenial seizures. There could also be 90 minutes of early morning or repetitive myoclonic jerks in like a JME type of epilepsy. So these are all examples, just for illustration, of different ways that different types of patients may experience seizure clusters. Now, often we get the question is like, what are the potential risk factors? Who are more likely to get these type of seizure clusters? And the research we've done in this area, and the literature also points to this, is that you're at higher risk of a seizure cluster if you have severe or refractory epilepsy. That could be things like a prior diagnosis of status epilepticus, if the patient has a history of epilepsy-related hospitalization, generally poorly controlled epilepsy, temporal or frontal lobe epilepsy, or seizures that happened at an early age of onset. These are broadly the bigger risk factors for experiencing seizure clusters, but they can happen to anybody at any time. So it's important to also recognize triggers for these types of seizure clusters. So that could be things like sleep deprivation, an increase in stress, potentially fever or other illnesses, missing or changing medication, and as I mentioned earlier, menstruation. These could all potentially be triggers that lead to seizure clusters for different categories of patients. Now, it's also important to highlight here that there is an urgency to treat seizure clusters. We know that highly disruptive life events for the patient, for the caregiver, it can lead to feelings of frustration and helplessness for the patient. Often they happen without warning, and there are serious consequences by not treating those seizure clusters appropriately. They potentially could lead to injuries, often hospitalization, and there is the risk that untreated seizure clusters could progress to status epilepticus, which is a seizure emergency where seizure is essentially lasting longer than 5 minutes. So with that in mind, we do recommend for all patients to speak with their HCP, and I know the Epilepsy Foundation also advocates for this, is that the importance of seizure action plans. We know that seizure clusters can be unpredictable, and it's important that we are preparing patients and their caregivers about what to expect and what to do when that emergency happens. So the acute seizure action plan could be like a subset of your general seizure action plan, but there should be an area in there for acute treatment. So it will provide patient information and instructions for how to handle a seizure emergency. So it could give them information about the person's usual seizure patterns, when is a seizure considered to be an emergency, what type of care is required, how and what rescue medication step-by-step instructions should be provided to that patient to effectively treat that seizure cluster. And it's also therefore important to have a rescue medication on hand at all times, essentially, where you may have the risk of a seizure cluster occurring, obviously to avoid those serious consequences that I mentioned earlier. Now, what is a rescue medication? Obviously, Kelly also described the Valtoco product here, but rescue medications as a class, and it's important to have this understanding, they're only taken as a when needed type of medication. They don't replace your existing daily epilepsy medications, and it's important that you continually take those as prescribed by your HCP. These are kind of an as-on, as-needed type of treatment. You should always take your daily seizure medication as directed by your healthcare provider, and the rescue medication is there only to treat the seizure clusters if and when they occur. Now, often I speak to patients or other HCPs, and they speak to me about why is it important, why is it helpful to have a rescue medication on board? Essentially, it helps to stop the seizure quickly. So essentially could prevent the need to go to hospital as one positive example of that. Nayzilam in particular allows you to feel like yourself again relatively quickly because it's a shorter acting benzodiazepine. It has a much lower time to Tmax, or time to highest concentration, around 17 minutes. It prevents additional seizures occurring within that cluster, and having it on hand, is also, if you're with, say you're traveling, or even if you're at home or work, it can be given by anyone, anywhere. So it provides a sense of reassurance that you have something at hand to treat your seizure clusters as and when they're occurring. So that kind of sets the scene or the background to seizure clusters. Why is it urgent to treat them? What are rescue medications more broadly? Now, specifically on Nayzilam, it's indicated, like I mentioned, for patients 12 years of age and older. Nayzilam um, is a sorry. Nayzilam is the active ingredient is midazolam, which is a type of benzodiazepine. These, as midazolam, it's been used for many decades within epilepsy, so there is a long history in terms of understanding its efficacy and safety. This formulation of midazolam as a sorry, it's getting updates at the same time. Um, this formulation of midazolam is as a nasal spray, so it's used in a new formulation that was launched a number of years ago here within the US. Again, the boxed warning talks about the use of opioids, alcohol, and CNS depressant effects when used in combination. So how is Nayzilam administered? So it's a nasal spray. It can be used in the outpatient setting. Importantly, there's no priming or assembly necessary. It may be given during or after a seizure cluster. It can be given anywhere, like I mentioned, at home or school. And it's important also to emphasize it's a federally controlled substance in Schedule 4. So, we like to use Nayzilam as you don't have to wait to treat this cluster. You can actually give it immediately or during the cluster itself. So even if the patient is unconscious, there's no inhalation that is necessary. It's important for the person to be able to identify the seizure cluster and how to give that rescue medication. And I'll speak a little bit about that as well in terms of administration instructions. The only real contraindications to Nayzilam is if you have an allergy to the active ingredient, which is midazolam, or if you have a particular type of eye problem called acute narrow angle glaucoma. Throughout the studies that we've done on Nayzilam and the are here on the screen. So most commonly it's sleepiness in the nose. Often these are the most often side effects that we see. They could cause other serious side effects, things like impaired mental alertness or memory problems as well. So it's important to be aware of that. So how can Nayzilam help you as a patient, or why is it important for caregivers to think about its utility? So we know that Nayzilam can stop the seizure cluster within a number of minutes. It does prevent further seizure activity for up to 6 hours. It can help you feel like yourself within hours, and it stops future seizures from returning for up to 24 hours as well. We know from the phase 3 placebo-controlled studies that Nayzilam helps stop the majority of clusters within 10 minutes, and we see a return to baseline functionality because it's a short-acting benzodiazepine within 90 minutes in most patients. That's very beneficial as a patient or as a caregiver because often if you have had a seizure cluster, you want to quickly return to your normal day-to-day activities. We don't want to have a really long sedating type of medication. And that's one of the key benefits of Nayzilam within this space. Again, these are the most common types of side effects, which I mentioned: sleepiness, headache, runny nose, throat irritation. This is also a really good slide, just so you'll see what you'll receive at the pharmacy itself. So Nayzilam is supplied as 2 single-use nasal spray devices. Again, these are stored at room temperature. There's a 2-year shelf life that's very beneficial for patients and caregivers. So even if you're not needing to use this very frequently, you can have a supply that lasts you for 2 years and you can keep it with you. So that's very beneficial, and we've had very good feedback from patients and caregivers for that utility. Again, it's different from your daily prescribed medication. You should keep taking that daily prescribed medication. This should be an as-needed add-on medication. It's widely available through regular local or mail order pharmacies. But also, as a pharmacist, I know this as well. It's also good to call ahead of time sometimes just to make sure that the pharmacy that you're visiting has it in stock, or allow 24 to 48 hours for it to be delivered to your pharmacy. So if you are traveling or you need it for a quicker time, that that you've got a supply of it readily available, and it is readily available throughout the US. In terms of dosing, it's a very simplified dosing. So this is also a really important feature of Nayzilam. We feel that as an emergency medication, you can imagine yourself dealing with a seizure cluster is quite a stressful, potentially frightening experience for the patient or the caregiver who's administering this medication. So we've tried to simplify and ease the dosing as much as possible. So it only comes as one 5 milligram dose. There isn't multiple different dosage forms. There isn't prescriber doesn't have to calculate any dose based upon your weight. It's just a standard dose for those over the age of 12. So it's one 5 milligram nasal spray in one nostril. If the seizure cluster is continuing within, let's say, 10 minutes after the first dose, you can give a second dose if needed and as if advised by a healthcare provider. You can repeat that dose of 10 minutes, give a second dose in the other nostril. And it's important not to give more than 2 doses to treat a specific seizure cluster. And again, it simplifies the dosing, one dose in one nostril. If it doesn't stop within 10 minutes, give the second dose in the other nostril, and it should abate the seizure pretty effectively. Again, it's not intended for daily use. If you use too much of the medication, it's important to speak to your healthcare provider or go to the nearest emergency room right away. Importantly, if the seizure doesn't stop after the second nasal spray dose, you need to get emergency medical assistance straight away. We advise not to use this medication for more than 1 seizure cluster episode every 3 days and no more than 5 seizure cluster episodes per month. The reasoning behind that is based as a class of medications, benzodiazepines, and the safety of using it too frequently, like I mentioned earlier on in the presentation. How do we give it? There's detailed instructions on the Nayzilam website at nayzilam.com, but this is a diagram essentially of how to give it. So you just peel open the blister pack, you hold the nasal spray with your thumb on the plunger and the middle index fingers on each side of the nozzle. Place the tip of the nozzle within the nostril until the fingers are pressed against the bottom of the patient's nose, and just firmly press on the plunger, and that should administer the dose. You then throw away the nasal spray and blister packaging because it's a kind of one and done type of delivery. It's important here because, particularly if you're new to using Nayzilam, not to drive or operate machinery or other types of dangerous activities until you're accustomed to how Nayzilam affects you, because as I mentioned, it could cause sleepiness or drowsiness or dizziness potentially. Obviously not to drink alcohol or take other drugs that may make you sleepy or dizzy without first consulting with your healthcare provider. Again, it's important to have those 2 sprays, or we recommend to have 2 spray devices on hand, just so you have coverage in case the seizure doesn't abate within 10 minutes, you can administer the second dose. Again, there's a detailed video of how to use Nayzilam at nasalrescuetreatment.com or nayzilam.com that explains what I've just described in a little bit more detail. Obviously, you're free to speak to your healthcare provider or pharmacist that could also counsel you on effective administration of Nayzilam. The next few slides are just important safety information. We do think it's important that patients and caregivers have all the information readily at hand. Obviously, you can refer to the important safety information at nayzilam.com, and you would be provided all this information in the package inserts at the time of receiving your prescription as well. Kind of the top line things here, we have the boxed warning again in terms of benzodiazepines. We know about the risks of use, misuse, and addiction, potential physical dependence and withdrawal reactions. Again, not to suddenly stop taking Nayzilam without first speaking to your healthcare provider. It can make you sleepy or dizzy. It could potentially slow motor skills. So again, not to drive or operate machinery until you're accustomed to the usage. Like Kelly also pointed out, like other anti-epileptic medicines, Nayzilam can cause or potentially has the risk of suicidal thoughts or actions. Very small numbers of patients, potentially around 1 in 500. But obviously, it's important to watch for early signs of suicidal thoughts or actions. And that's important for all anti-epileptic drugs as a class, as those have potential side effects with them. This just reiterates the top line information which I described. So again, it's used for patients over the age of 12. We know it's a federally controlled drug with potential for abuse or dependence, not to use if you're allergic to midazolam or have acute narrow-angle glaucoma. And obviously speak to your healthcare provider if you suffer from the list of these other medical conditions on the right here, just so you can have that back and forth with them to see if it's appropriate to prescribe and how to prescribe it for you. This is how you should use it. Again, we want to make it as simple and easy for the patient and the caregiver to administer the drug. You can repeat the doses within, if the seizure cluster is continuing within 10 minutes. Again, not to give more than 2 doses to treat a single seizure cluster, not more than 1 seizure cluster episode every 3 days, and not more than use of every 5 seizure cluster episodes per month. And again, not to use it as a replacement for existing medication. These are the most common side effects that you see. And obviously, we have further information, and we can provide further information from our phase 3 studies that kind of cover all the types of side effects that potentially could come about. But most commonly, sleepiness, headache, runny nose, nasal discomfort, and throat irritation. In terms of savings and supports, we do have a number of online tools and resources at nasalrescuetreatment.com that can give you more information about understanding seizure clusters, how Nayzilam works, how to use it, and how you can potentially save on the prescription costs. I've just highlighted a few of these here. So we have patient brochures that give you more information about how to use the drug. There's also a Nayzilam patient savings card where you could register online on our website, or also text or call those numbers. Again, we also have an online training kit on our website where, just so you get familiar with the use of the drug itself. It's a dummy device, so there's no active drug within the device itself, but it gives you a chance to order and train on the device, so you get a feel for the look and feel of the device itself, and the patient or the caregiver can get comfortable using it prior to use, potentially in a real life setting or in a seizure emergency. If you do have more questions, feel free to reach out to UCB Cares. So that's at askucbcares.com. We also have a phone number listed there. So this is staffed by nurses, pharmacists, other customer service professionals, and provides you a wealth of information on all UCB products. So you could ask questions about any of our drugs, get detailed clinical trial information and support, obviously report any side effects or product quality concerns you may have, and then find out more information about affording UCB medication. So I would encourage you to reach out to UCB Cares if you need to. And thank you very much for your time. Happy to take any other questions.
All right, thank you so much. Thank both of you for your time and for your really informative presentations. We're able to learn a lot about the different rescue medications. If anyone has any questions that you think of as we go, feel free to drop them in the chat. We'll try our best to answer as many as possible. One question that I know that did come up for Valtoco specifically was regarding oh, if someone doesn't need a full box of 5, are there alternative options available? So I guess like what are the options for how many you receive in each box?
Yeah, so can you all hear me okay?
Yes.
Okay. Yeah, we did make that switch from the 2-dose to the 5-dose for the reasons that I explained. And there isn't a 2-box anymore. And we thought that, and the reason for that is that we didn't want to continue the confusion with providers. So if we had 2 different choices, it would really not solve the issue. So we just have the 5-dose, and it is recommended that you not like break the boxes, meaning the pharmacies don't break the boxes. So it would be just a 5-dose. I did mention that we had a 32 or 36-month shelf life for the product. So it does last for basically 3 years. So that is one of the benefits with regard to the shelf life. So for all intents and purposes, we only have the option of getting the 5 doses. And, the other thing is, if you think about when you get your box of Valtoco, you get 5 doses in the box. So you do have less copays per box as well. So, which I know doesn't address the issue if you don't need that many, but you never know how many you're going to need too. So.
Thank you.
Hopefully that makes sense and answers the question.
Yes, thank you so much. Let me check the chat if there's any other questions coming in. For the I guess a follow-up question would be for the Nayzilam. How many usually would come in a box for Nayzilam medication?
Yeah, so Nayzilam, the box contains two devices. Again, it has a 24-month shelf life. You may not need more than that. You might, two is sufficient within the package that you'll get two devices. But I think, like I mentioned in the presentation, the idea is to simplify the dosing. There isn't any type of confusion. There's not a weight-based dosing. I think with diazepam, because it's a longer acting benzodiazepine, and historically it was used as diastats, as some of your listeners might be aware of. It was the same drug, so it's a weight-based dosing. But with midazolam, because it's a shorter benzodiazepine, it's just a standard 5 milligram dose. For ease of administration, there's no real confusion about dosing. I think that's the feedback we've got, as well as, it makes it easy and simple to administer, which is kind of what you want in an emergency.
Thank you. One question that also came in, I think we did touch on this several times throughout the presentation as well, but I guess just like as kind of like a summary, what are kind of the main differences between intranasal midazolam and the diazepam? I know that might be kind of like complicated with like the composition of it, um, but if there's kind of like a summary of the di main differences.
Yeah, I think the main difference, and probably Kelly could speak to this as well, but it's a pharmacokinetic difference. So benzodiazepines is a class, you can class them as like short acting and longer acting. And it kind of depends what you want in this case, but essentially with midazolam, the Tmax, so the time to maximum concentration, is around 17 minutes. In a diazepam type of drugs that applies to Valtoco or a diastat, it's around 1.5 hours. So that's one of the key differences. Um, and that's related to also the dosing of it. So the dosing reflects that, the fact that we have a shorter half-life as opposed to diazepam. That's sort of one of the key things. The frequency of administration is also going to be different. So, we recommend no more than one episode every 3 days. Generally speaking, diazepam is like one every 5 days because it's a longer acting drug. So these are kind of like the key differences between, in terms of the PK effects of the drugs. And that's important for the patient or caregiver because it's a kind of a return to baseline functionality, like I mentioned. We want the patient, by using midazolam or Nayzilam, that the dose would be administered, the seizure cluster itself is quickly treated, but then importantly, the patient can quickly return to their normal baseline function. They're not feeling drowsy or sedated for long periods of time. So we want them to go back and go back to the normal day-to-day activities. And I think that's kind of the feedback that we've had from a lot of patients and caregivers, that they appreciate that part of the formulation, which makes it useful for them, that it doesn't interfere with their day-to-day life.
And I'll just add to that. So with, obviously just for everybody's sake, we don't really have head-to-head data. So from a research standpoint, but I would just add with Valtoco specifically, that we did talk about the dosing with regard to the individualized dosing based on age and weight, which does give more flexibility for both children and adults. And then just regarding, I think the term pharmacokinetics, might be not as familiar to most people, but that's kind of how the drug acts in your blood. We have done clinical research with Valtoco, meaning how does it affect in real life? And we found that when it's administered within 5 minutes, it'll stop the seizure in as little as 2 minutes. And so the maximum concentration in your blood does not always correlate with the time of onset, because you don't need a really high level to start having anti-seizure effects. So that's just one of the things about Valtoco is it does work quickly. And then it also, in our clinical studies, we showed that people return to their normal selves within about an hour. So we, from a clinical standpoint, So I think it's really important as you look at your own, situation. And obviously, we're not able to provide medical advice, but it's great to have options, and it's really important to talk to your provider about your exact kind of seizure patterns. And that's why it's really important to keep, like a seizure diary, or to really, I think even like the apps today, you can kind of do it digitally and really know exactly how your seizures are, because that may guide your provider and which treatment they pick for you. So,
Hello. This is actually perfect timing. The question popped up in the chat, as well as this is a question that we get from a lot of schools as well. With the packaging being so similar for most of the rescue medications, from anti-seizure medications to Narcan to intranasal EpiPens, is there a possibility or a chance that there could be a change in the packaging, make it more easily accessible, as well as better access to some type of change in that design?
are you speaking specifically of the actual device, meaning like the way the nasal device looks, or the coloring on it? Because I do know that Narcan, for example, is more of like a black and red. Um, and then, Nayzilam has different coloring than us, but the actual device, I think it is the same device. I think that would be difficult, and I don't know if Raj has any insights. I think at this point, that device is very effective for a lot of these products. Like you said, there's now a intranasal for allergies, kind of like an EpiPen intranasal, the Narcan, all of that. I think it's just really important that the education is there for, school nurses and what it's there for. But I don't know, Raj, if you have any other ideas on whether there would be a change in the actual device. I know from Norella's standpoint, we're not planning, we don't have any plans to use a new device because the device is very reliable.
Yeah,
Yeah,
we like the design of the device. It's more of the aesthetic colors of it, especially in some of the packaging.
yeah. I mean, I would echo what Kelly said. I'm not sure if there's any plans to change packaging or colors or designs of packaging, but we take any feedback on board for sure. But it just speaks to the idea of the importance of seizure action plans. That the schools or where these drugs are going to be administered, that they have the right information about how to use it, what it is, and they have a great deal of clarity. So I would just say that, if you do have a seizure action plan, make sure you have an acute seizure action plan. Make sure it's shared with wherever school or even workplace that you might administer these seizure cluster emergency medications, so that they have clarity of what they're administering, how they're administering, how to identify the seizure cluster. And like Kelly rightly said, it's an education type of thing, but I don't think there was any specific plan to change color or packaging.
All right, thank you. And then another one that was brought up was I know both of you shared that you have a quantity of devices. With Valtoco, there's about five, and then the other one, there's about two. Is there a better way for schools or the families to reach out to your agencies to get multiple devices, or more often some of these devices, for the school staff, in case the school needs two or three of these devices and then the family needs two or three? I know Valtoco, you have about five, so that's almost that perfect ratio sometimes. Just curious if that's easier, if they go through you faster versus insurance.
Yeah, I can definitely find out more information about that. It might be like a local situation that they might have the need for more devices on hand. But generally speaking, if the say it's the school and the child is and the patients or caregivers, they speak to the HCP, they could assess how many devices is realistically needed for that particular patient. Like I said, and like Kelly reiterated, generally HCPs don't like to prescribe large amounts of these types of drugs in one go because of the abuse potential of benzodiazepines generally. But it might just be a conversation that the patient or families have with their HCP, make sure, and they assess rightly how many devices would be suitable for this particular patient. and then share that with the school or the workplace to make sure that they have enough on hand for that particular patient. And I think that's probably the right way forward, rather than just keeping it and storing it, because it's a controlled drug. So there's also sort of storage requirements and other, compliance issues that might come about for schools and workplaces by storing large quantities of controlled substances.
Yeah, and I would just add to that, I think just from a insurance standpoint, insurance companies for both products would pay for up to 10 doses a month in the cases where it is needed. So you do have that option. And I think that's great what Raj said, just checking with your provider and making sure. And then, you can also, if you use the one for school, you can then, make sure you're replacing them with what you might have at home.
Perfect. Thank you.
Thank you. Um, does anyone else have any other questions? Feel free to share in the chat. I will mention briefly that Alex and I do have seizure first aid training that we are able to provide for schools and other organizations. We do actually mention the seizure rescue medications and administration of seizure rescue medication in the training. So if that's anything that you're ever interested in, or you know someone who might be interested, please let us know. Alex also dropped a link in the chat. You can schedule that. I think that's for a form that you can fill out. So feel free to let us know. We'd love to talk with you about that. And if there are no other questions, we can wrap up. And we end a little bit early, but I just want to say thank you once again to both of you so much for being here with us today, being our speakers. We really appreciate it.
Thank you so much. Thanks, everybody.
Thank you.
Thanks, everyone.
All right. Thanks all. Have a great rest of your day. I'm going to share a follow-up email with everyone who registered. I'll share resources from the discussion today. And this will go up on our YouTube page later. So if you want to rewatch it, someone who might be interested, feel free to share. All right. Thanks, everyone.